Hello, my name is Will Corrigan, Account Executive with Regen Med. In this video, I will provide a step-by-step walkthrough of the patient experience registering and entering their baseline survey into the MOTIV platform. The patient registration and case enrollment experience is centered around your customized enrollment materials, so let's take a look at them. They consist of a brochure with QR code, which leads to the patient enrollment portal, and also a unique URL for your customized patient enrollment portal. This is your QR code brochure. The top banner will have customized branding reflecting the physician and the clinic. This brochure is printed out and handed to the patient by office staff at the time of their visit. The patient will scan the QR code with their mobile device, and they will then be led to the patient enrollment portal. The patient enrollment portal is a unique gateway for patients to register and complete their baseline survey. This portal comes in the form of a unique URL reachable from the QR code brochure. It can also be embedded within the clinician's EMR to be sent within text and email communications, or even loaded onto a tablet device for in-office use. We recommend the latter, so the baseline surveys can easily be completed within the office at the time of the visit in the event the patient has any questions. Once arriving at the portal, the patient will select the specific anatomical region of their treatment. This is easily completed as there are both graphical and text elements to guide the patient. As you can see, there is additional information on pathology, treatment protocol, and what outcomes assessment is being utilized within the survey. While on the patient enrollment portal, the patient will click the Enroll button under the appropriate anatomical region, and they will be prompted to enter their email address. Once the patient enters their email address, they will be emailed a verification code to set up their account. They will be prompted to enter a password at this time as well. When this is complete, the patient will be prompted to enter their name, country, date of birth, phone number, and their treatment date. Please note, when completed in office using the brochure or PEP, the treatment date will be the date that they initiate their registration. At this point, the patient will be prompted to accept the license agreement and patient consent forms. If the patient has any questions about the consent form, an office staff member can provide any clarification needed for good clinical practice. Next, the patient will be brought directly to the platform to complete their first survey. They will also receive an email reminder to complete this first survey, and when accessed on their mobile device, be prompted to download the Benchmark app. This app houses the patient side of the MOTIV registry and will allow push notifications on their phone in addition to email notifications. Let's take a look at the patient experience completing a survey based on Visual Analog Scale, Coos Jr., VR12, and Oswestry Disability Index questionnaires. Now that a baseline survey is completed, the patient can browse their benchmark profile and feed if they wish. Benchmark, as mentioned earlier, is the patient-facing side of our platform. The patient will complete subsequent follow-up surveys from Benchmark, and they can also view their overall treatment and health progress within it. The patient may also review their signed consent form here. This treatment protocol has follow-up surveys to be completed at 2 weeks, 6 weeks, 3 months, 6 months, 9 months, and 12 months. When a follow-up survey becomes due, the patient will receive an email requesting that they complete their latest health assessment in Benchmark. If the patient has downloaded the Benchmark app, they will also receive a push notification from the app to notify them when it's time to complete a new survey. The patient will log in and complete their survey the same way they did for their baseline. When follow-up surveys are completed, a graph of their progress will be generated. Let's take a look at a simulated graph of treatment progress over 12 months for this patient.